You heard I'm working here in Berne for many years, and I'm specialized in psychiatry, and I did a lot of science, especially in the field of psychosis and hallucinations. And during the time we started to do the interventional psychiatry. I'm quite interested in the field, and I hope I do not have too many slides. So we will see. I will try to keep in time, and maybe I have to skip some parts. But now let's start. I will give you a lecture this evening in non-invasive brain stimulation in schizophrenia. And first, I will give a short introduction into the symptoms and the domains of schizophrenia, which are covered and reached by these methods. And in detail, these are the auditory verbal hallucinations. This is just one symptom in the plethora of the psychotic symptoms. But also, NIBS is used in negative symptoms and only recently in cognitive symptoms. And the methods mainly used are the RTMS, the transcranial magnetic stimulation. All of you know, I'm sure, the transcranial direct current stimulation. And I allowed myself also to introduce or to include in these talks the ECT. This is not traditionally NIBS, but it's older. And for one kind, it's also NIBS. And if you give a talk on interventional methods used in schizophrenia, you must name the ECT2. It's somewhat difficult to make a very straight line through the talk. There are some papers which cover TMS, others TDCS, others NIBS, some schizophrenia, some only auditory hallucinations. I try to guide you through what I presented. But in the first part of my talk, after the introduction of the symptoms, I will focus on some scientific papers and on the neurobiological, neurophysiological, pathophysiological background of the disorder and the treatments. And in the second part, relatively short, I will present you some clinical guidance. So let's start with a global introduction. I think it's quite noteworthy that especially in psychiatry, we have this approach of a translational medical approach, that we come from science. We have some informations we got from the pure scientific studies, and these has been transferred into the clinical practice. And I think this is in front of the background of the psychoanalytic history of psychiatry, quite interesting that we have in this field of the medicine, this translational approach. And on the other hand, what we do with NIBS methods, it's pure in this field. We have now very modern, the precision medicine. We have a very precise hypothesis in the very individual patient, which can be applied. It's not a global method, but a very precise method. So here I have as an example, and I will come to this later in more detail, that we have in patients who hallucinate auditory, verbal hallucination. This is the classical hallucination in schizophrenia or in psychosis. And we have the most data on this because this is the most common symptom in schizophrenia. We have a pattern of activated, hyperactivated, and pathologically activated brain regions. And this gives us a theory. And coming from this, we start to modulate, in this case, to inhibit the hyperactivations with a TMS treatment. And this approach is common in all further applications, independent of the symptom and also independent of the method I will show you.